This Togolese woman by the name Happy never imagined that she would lose her footing after a family crisis. She would later suffer from depression for several months. I was aggressive. I wasn't myself. At that moment, I was hearing voices, and I was seeing things that I shouldn't have been seeing. I was also smelling foul odors. It took several months of hospitalization for Happy to regain a taste for life, and that included a stay in one of the few psychiatric centers in Togo like this one. The demand for mental health services, already high in Togo, has been worsened by the COVID-19 crisis.
En 2020, au centre ici, par exemple,
In
on
2020,
était
at the center here, for example,
27
we
patients
were
par jour.
almost at 40
Mais
patients per
aujourd'hui, on
day.
est près de 40
Our
patients aussi par
inpatient
jour.
wards were filled to
Les cas
capacity. With
d'hospitalisation
COVID,
sont
we've
vraiment
had
augmentés.
relapses.
Et avec
People who were already ill
des
and had
ressources,
stabilized
des
were
gens
finding
qui étaient
themselves
déjà
in
malades,
trouble.
qui sont stabilisés, se sont retrouvés dans des problèmes.
There are still thousands of Togolese who have difficult access to mental health services. According to Handicap International, there are 6 psychiatrists in the whole of Togo. That is to say, one specialized doctor for 1.3 million inhabitants, whereas the WHO recommends one doctor for 5,000 inhabitants. Our plea is to make mental health a priority in this country. You will see that with the pandemic, there was a lot of depression and suicides as well. So it is important for government to make mental health a priority in the country. The government also needs to raise awareness so that people can take charge of themselves. The World Health Organization, WHO, estimates that 450 million people today suffer from a mental disorder and that a quarter of the population is affected by this risk.